He knows the story. Just put it on here, put it on the slideshow, and just turn on number 2, and then normal to see it.
All right, aloha, welcome back to Kuleana Community Talk Story. Shout out to our sponsors, Cancer Office, Kupuka, Kilohana, and the Center for Global Education and Exchange. Also, since it is well on topic, I want to talk about the counseling centers. We have free counseling services, walking Wednesdays, or you can make an appointment. So check them out. They're on the table over there. Today, it's going to be a really interesting kind of talk, and delving into the therapy session, if you will. Melissa Bartholomew, alumni, I believe, of Hilo, is a practicing counselor for 17 years for Braga Bound. She is also our newly hired program coordinator for the Masters in Psychology program here at Hilo. And she's going to be talking about, again, the deep dive into what really happens in therapy. So without any further ado, Melissa Bartholomew.
Well, thanks for coming, everybody. This is an exciting topic. Love to talk about therapy anytime I can. And it's kind of fun because, I don't know about you guys, but it's kind of like what happens in there, right? It's a private space. People who go to therapy are not really talking about maybe necessarily what they're doing or not doing. And so we get to kind of get a little inner look into that. So a little bit about me. Yep, a dog. This is my dog, Mochi. He's a therapy dog in training. Some of you may know him. But I grew up in the South. I was born in Texas. I've lived in Louisiana, Mississippi, and I lived in South Carolina before I moved here. And for me, therapy was not something really on my radar growing up. I didn't personally know anyone who went to counseling. The only exposure to counseling I got was, the TV, where someone's sitting on a couch, telling someone else about their problems, and it looks kind of weird, didn't really know about that profession. And then when I was in college, my dad, he had a long struggle with cancer, and he passed away. And one of my friends in high school, she also had a mom that had a long battle with cancer and passed away a few years before my dad did. And at the funeral, she gave me a really amazing letter, and in that letter, it basically said, go to therapy, go now. And even though we had grown up together and we had both been experiencing something similar that was very heavy, we didn't really talk about it a lot. And so she said, don't be like me. 5 years after my mom passed away, I was having a panic attack from something random, that happened. She's like, start talking. And so I took her advice. And so I went, and I was a student here at Hilo, and so I went to the counseling center for my first experience with counseling, and it was awesome. And it was weird, because I don't know if you guys have ever been to therapy, but it's a different kind of relationship. It's not like your friend where you're both kind of interacting. I remember when I went to counseling for the first time, I had never had a relationship like that before. Usually it's going back and forth. And so she's like, okay, why are you here? And what do you want to talk about? And I told her, and I'm like, well, how are you doing? What's going on with you? And she was like, well, we're here to talk about you, And it took me a couple sessions it felt a little uncomfortable, honestly, at first, because I'm like, this is kind of different. And so that's kind of how I got exposed to the job and found out, wow, this is a really cool way to help people and be there for people through some tough times in life and help them kind of see the other side. So that's how I got into counseling. I do have a private practice as well, and this is my therapy dog, Mochi, he's in training. And so that's a lot of fun. I have a great team with me as well, and my intern, Kuleana, sorry, she probably didn't want to shout out, but she's getting her master's in social work, and we just have a great team of people. I think counseling is definitely, even though you're in there individually, it is a team effort, always. So today we're going to talk about the relationship between the counselor and client, which is everything, but it's very, very important. And we're going to talk about therapist training, the kind of training that they get when they're getting their masters. And we're going to go through a vignette, a real life example of maybe someone who wants to go counseling. And then come back. So in therapy, there are, it's a wide range of people seeking counseling. So you have kind of like the ring everyday stressors. Sometimes it's just life is stressful. And you've got work or school, maybe parenting, relationship challenges, life transitions, sometimes even happy events. Right? first time. That's a good thing, but also stressful. Or getting married, or these kind of things. Personal growth and understanding. Sometimes people just want a place to come and talk about things. And then kind of have in the middle, maybe, and some of these things can certainly overlap, but anxiety, worry, and panic, those are not very fun, and a lot of people experience that, and sadness, difficulty focusing, grief, loss, and then you can have intense losing that people are trusting as well, trauma, intensity, severe depression, substance use, self-harm, and suicidal thoughts. But what I kind of wanted to express with this is that it's a wide range. I think a lot of times we think only certain people go to counseling, or people only go for certain problems. Not true. People go for all kinds of problems. I would say my youngest client is typically like 3, and then I have older clients into the 80s. I personally like to see the full lifespan, and it's really cool because people are there for all kinds of different reasons. And so therapy is really important. So the therapeutic relationship. Research has consistently shown, we call it a therapeutic alliance, is one of the most important predictors of positive treatment outcomes. So that means how you feel about your therapist, and it is going to be a strong predictor of how the therapy will be going to be successful or not. Which would make sense, right? Because we're going to therapy for some private things, a lot of times things that we're not talking to other people about. And so we really have to trust this person to be vulnerable, to just open up to them. So this relationship is very, very what do you guys think? I know the question is supposed to be later, but I'm curious. What do you guys think are some things that are important in a relationship? So what do you have to feel, or do you want to feel as a client?
Trust as well.
Yes, absolutely. Trust. Same. Yes. Do they believe you? Oh, yeah. Yeah, I think all of those. That they're listening. Absolutely. Yeah. Yes. Those are all essential. I would say everything you guys said is like essential. Because if you don't feel like they're listening, or you don't feel like people are judging you, all these things, you're not going to want to open up, and then you're not going to be able to go. I think that finding a good fit is really important. Therapists come in all shapes, sizes, clothes. They're very different. And, you may feel comfortable with one person and not another, and that's okay. And so it's really important that you find a fit. What's really cool about therapy, I think, is patients have a lot of power. So let's say you went and saw a therapist, you're like, I'm going to try it, and then you're like, they're listening. Well, heard, you can just switch to another provider. You don't even have to tell that person. You can if you want, but and a good therapist is also going to want you to have a therapist on the therapist side. You're only counseling people that are kind of in there waiting for you. So just talk a little bit about the training that therapists receive when they're getting their master's. So ethics is a really big one for counselors. It's kind of the foundation of everything that we do. Some common things in ethics are full relationships, living in a small place. You may know a lot of people, or family with a lot of people. So you wouldn't want, though, your auntie being your therapist, or your cousin, or your mom. Because the therapist is supposed to be unbiased. That's one of their goals, is they're supposed to truly be unbiased. And in order to do that, they have to not know you in any other context, really, because we're human. So, they might be like, oh, well, if they know you, then they may know someone else's story about you here and there. And so you really want to find a therapist that doesn't know you. And so that's one thing is on the therapist side. And then also boundaries. Therapists again, it's a different relationship. They're not your friends, so they're not going to be, following you on social media. They're not going to be coming to your birthday party, things like that. So therapists on their side kind of have to teach clients what the relationship is, what isn't. They're certainly there and present and absolutely care about you. But in order to do that, they have to hold a good boundary where they're not, overlapping in these other areas. Theoretical orientation. How many of you guys heard of cognitive behavior therapy? It's probably the most popular theoretical orientation if you're doing this evidence-based. And so when counselors go to school, they learn about theoretical orientations, ways that they can help someone with certain problems. And they learn several different theories and then try to kind of say, okay, I think this one is probably going to work. I believe that this one will work to help others, and then they use that. So that's one thing that they learn. Counseling skills. Listening is a very big part of being a counselor, so you practice listening. We have to record ourselves when we are in school, and you get to look at your nonverbal behaviors, so embarrassing, and listen how your voice sounds to other people. And, but then you also find out, just how to rephrase things, how to, keep the conversation going in a productive way, the way you want it to go. So those are kind of some things. Assessments. We're going to talk a little bit more about assessments, but assessments are a very helpful tool for us as therapists because it kind of gets us a gauge of where people are at. So most common things people come into therapy for anxiety and depression. And so we may give them an anxiety inventory or depression inventory. I brought some with me if you guys are interested. We'll look at them. So this one is called, a very common one called Patient Health Questionnaire. This is for depression. And it says, do you have a little interest or pleasure in doing things? And the client will just kind of say, not at all, or several days, more than half, or nearly every day. And there's just some questions here that kind of give us a good idea of maybe what someone's doing and how intense it is for the feeling. Here's another common one for anxiety. Questionnaire. Are you feeling nervous, anxious, or on edge? Kind of how often that might be happening for you. Trouble relaxing. And so at the beginning of treatment, we may give clients some of these assessments to kind of get a gauge of, how they're feeling, what kind of things they're experiencing. And it can be really helpful because maybe they're in treatment in a couple weeks, we give it to them again, and we can see, have these things improved? Are they the same? Are they getting worse? So as therapists, it really helps us to know, okay, so we're going in the right direction. And then I brought this big, beautiful book, because it's just so much fun. It's called the DSM. I don't know if everyone's familiar with this book, but it is a book of disorders, and this is another thing that therapists study in school. Some of you are studying it now, I know. And it's great because it gives therapists an idea of what disorders are and what kind of things can treat them as well. So they're studying a lot on how to help. So those are the foundations for therapy. And I'm like, what happens to therapy, right? We haven't even talked about that yet. So that's hopefully what the therapist is bringing into the session, just as their foundation. So we're going to do a real life example of someone maybe coming in for anxiety, an amazing volunteer that has agreed to read our vision. So,
okay, Malia is a 27-year-old graduate student who recently moved away from her close-knit family to attend school. Over the past year, she has noticed increasing anxiety, especially around academic performance and social interactions. She often worries that she's not good enough compared to her peers. At times, these worries keep her up at night, and she finds herself procrastinating on assignments because she feels overwhelmed. She describes tightness in her chest and racing thoughts before class presentations, sometimes avoiding them altogether by asking a classmate to present for her group. Although she has supportive friends, she rarely opens up about her struggles because she doesn't want to burden them. Maria says she came to counseling because she feels stuck, tired of being in her head all the time, and wants to be more present in her life.
Thank you so much. So that's a pretty common example, I would say. Makes sense. She's got some stress going on. And that's kind of what I think a lot of times when people come to counseling, they're like, oh, I'm feeling this way or that way. And like, a lot of that makes sense to me. You know, we've got a lot going on in our lives. And so what we might do, you know, if she were to call, she might not have shared all of that in the first time to set up. But I'm going to, you know, usually we give psychoeducation. So we might say, okay, it seems like you're feeling some stress. You know, what I kind of heard was, okay, maybe you want to work on helping her with her self-esteem, kind of increase her self-esteem. I kind of heard some thought patterns in there that weren't so helpful. So I'm thinking maybe we're going to work on some of those thought patterns to help her feel even better and more confident. And then she's, you know, she mentioned that she doesn't really talk to people about things. And so I might be thinking, well, let's try to find someone in her life that she trusts that she could do. And so, as a therapist, you might be thinking about that. And so you might give her some psychoeducation and say, okay, again, first the therapist needs to figure out, could I probably help this person with these problems and feel better? Because if they can't, then they should refer to someone else who can. And so if they can, then they say, okay, we're going to come up with a plan. Okay, it's, you know, thanks for reaching out, and I think that, you know, we could work on this together. You know, and so you might say, okay, do you want to come in once a week? You know, do you want to come in every other week? Usually for starting therapy, those are the recommended things usually. A lot of people, you know, some people, everyone is so different. Some people are like, I just want to come in, you know, address this problem and get out, you know, which is great. And it's good to kind of know that up front. And so you're like, okay, that's the plan. We're going to maybe meet every week for 4 weeks and see where we're at. You know, and then other people are like, oh, I don't really know what's in, so we have a starting place. You kind of just come up with a plan, okay, well, and some, you know, also sometimes people are like, every week is too much for me. You don't meet every week, you know, and so then you might say, okay, well, let's start every other week. Or you kind of have to meet the client wherever they're at. And sometimes you want to have their lunch break. Meet them on their lunch break. You know, so there's, I say that all to say that therapy doesn't have to fit in this 60-minute box every single week. It's a wide range of meeting times and availability based on what the client needs. So you're going to come up with a plan, express that with the client, and see, okay, does that sound good? Okay, yes it does. You're going to go ahead and schedule to start the week. Another thing I would say with new clients is, or any client, is you kind of want to have a holistic approach. We will be talking about these things, but I'm also going to be interested in, you know, is this person eating regularly? Their stress, right? I'm very interested to know how their eating habits, you know. When is the last time they hired just a primary, you know, with their primary physician? I'm going to be wondering, do they exercise? Do they get outside? You know, so those are some things, although the client can present those as issues, I'm certainly going to ask about, because we know that all those things affect them well. So, counseling overview, it is a collaborative relationship, always. And that's something that I like to express to the client, is, you know, we are going to talk about this. This is like the loose plan of what we're going to do, but like, we're going to be checking in each other. Is this working? Does this sound good? Because you're there for the client. My personal theoretical orientation that I usually use is called Acceptance and Commitment Therapy, ACT. And it is a theory of cognitive human therapy. And it believes that all human suffering is a normal part of life. People are anxious, a normal part of life. Everybody feels anxious in some way. Feel sad or lonely, that's part of the human experience. And instead of saying, we don't want that, of course I would love to not feel those things. But instead of trying to get rid of those thoughts, which is impossible, we are going to learn to make room for them, and we're going to learn to focus on the values that we want to live, and focus on that. And then when we do that, those thoughts that are not so pleasant tend to get quieted, and they do not stress us out. And so I might give them just a little overview of what ACT is and some things that it entails. It does use mindfulness. Some people are really open to mindfulness. They love that idea. Some people are like, that is weird. I don't want to do that. And so you're just kind of working with clients wherever they're at. And so we talk about that. Cognitive confusion is a huge part of this model. So if you're anxious or depressed, usually what happens is you have a thought that comes into your mind, and you believe that thought. So for her, it was, her thought was like, I'm not good enough, or I'm going to mess up. And what happens is that thought enters her brain, and she believes that thought. And she's like, her body starts breaking that thought, and she starts getting really stressed. Cognitive confusion says, let's separate yourself from your thoughts. We have some crazy thoughts, sometimes that we don't want, but into our brain, especially under times of stress. And instead of, believing those thoughts, we're going to make some space between ourselves and our thoughts. Say, oh, that was our automatic thought. I'm not good enough. What can I replace that thought with instead? And so cognitive confusion does exercises like, I'm having a thought that I'm not good, instead of I'm not good. See the difference between those thoughts? And so we kind of practice some of that. And so we kind of decide where we're going to start. And so reframing thoughts is a very big part of a lot of counseling. And so the automatic thoughts I kind of like to think of like a roller set. Whenever you have an automatic thought that's stressful, it's just distracting your brain where she might think, I'm not good enough. And then she watches this terrible movie in her head where she's now failed school, been kicked out of school, and worst case scenario, we kind of, when we're under kind of stress, our brain might do that. And that's her automatic thought. She goes there, she's feeling stressed. So what we want to do is we want to put some new train tracks on. It is going to, be a lot harder at first, but it's doable. So what that looks like is catastrophizing. So if I mess this up, this presentation, everyone will think I'm stupid, I'll fail out of school. A reframed thought might be, I might feel nervous and make a mistake, but probably most people are going to understand and won't really remember. I prepared, it's more likely it can be just fine. And so you kind of learn to identify the automatic thought. Oh, here it is. Of course, I always do this many presentations, and then you think, but I'm probably not. It's probably I'm going to go nervous. That's okay. It's probably okay. And then you start to build this other track. And then the more and more that you build this other track of thinking, and it has to be realistic, so we work with clients individually with very specific thoughts, and what new train tracks are believable and real. It's not where the goal isn't positive. It's not that we let's be positive, but it's like let's just be realistic, and the brain believes realistic. And then the more and more you start to use this track, the easier it becomes processing the brain. Actually, it's the neuroplasticity where your brain is building new pathways that for you that are much easier to access. And over time, the old thoughts, while they still might have a pathway, it becomes overgrown and not used very much. So those are kind of some things you might explain in counseling. Catastrophizing is a very common thought pattern. So again, therapists need to really stay in their lane on what they're trained in. And so, but we also work with other, specialties. So again, we're often referring to primary care physicians, people have issues, even with anxiety. If someone comes in with anxiety, the reason I do ask, when was the last time you had an attack or maybe whatever time? Because sometimes people are low on their vitamin D, they have anxiety and depression syndrome. There's some people have thyroid issues, they didn't have it. And so that's why sometimes why don't you go get it checked out? Just so we can go out and these other things going on. Psychiatrists, we are not able to prescribe medication. And so sometimes people will ask about medications, and I would say, well, I've had some clients take that and work really well, and some side effects. I don't think that's so you need to go see a psychiatrist. That's what we will refer, out to people. Sometimes I hear people saying, oh, my therapist said I shouldn't do this, I shouldn't take medication, or I should take medication, and that's really outside of the therapist's lane. They cannot really make that recommendation. And so, again, it goes back to that. And then a nutritionist as well as doing people that we often interact with. Common myths, there's so many really, but therapy is only for people with serious mental illness. Right? It's for everyone, right? It's for everyone. Therapists will just tell me what to do. That's a big myth, actually. We're not supposed to be giving advice. So a lot of times people will say, what should I do? And we're not really able to say, oh, you should do this. We have to kind of say things like, well, what do you think, given this and that, and we kind of point things out, but we're actually not advice givers at all. So that's a big myth. Talking about my problems and making it worse. I know it's scary. It's scary to talk about problems that studies have shown me usually does. If I go to therapy, people will think I'm weak. We're learning these days are looking for people who are going to therapy. I mean, it's like everybody, I think we're in a great time in our society where I think the stigma is not as strong as it once was. 1 or 2 sessions will fix everything. It is. I know I kind of flew through these things today, but therapy does see patients on the therapist side and the patient side, both, and it's a different pace for everybody. Sometimes people feel a lot better more quickly, and sometimes it takes a little bit longer for others.
Questions for us today. So with what kind of space would you feel safe to open up? What would you want from a counselor or a counselor if you support? The second, one of those like cultures need one of the relational experiences shape as you and asking for help. So why don't we go ahead, as usual, we're going to groups of 5 or 6, talk about it for about 10, maybe 15 minutes, and we'll come back a little bit.
First question, so what kind of space do you need to feel comfortable to open up? What kind of space do we need to have that feeling that we can open up?
I think having as a positive guide, same like what we mentioned earlier, non-judgmental, completely culturally competent if you're coming to it wanting that most security in the culture and the therapy as well. Probably a therapy counselor that would push their own beliefs onto the client. I think that would maybe make the client more like
It's not about advice, but maybe a change in philosophy. So, yeah.
and body language. Maybe like you can just like making your face and then talking instead of being able to shut down.
Yeah, feedback. This is a lot, right? Even tone, right? So, anybody else? Yeah.
Okay, so it's not so much the space, which space is a nice place to think of it, but it's the relationship that makes you feel safe to open up. So, like I did counseling for an online teacher certification program, and they see me in person like once, and then most of my counseling sessions are over Zoom. But so much they know so long they know who I am and like what I can offer, that it's a fine space.
I like that. So it's not really maybe not the space, but the connection between individuals. Yeah. Anybody else? Well, what about the second part of this question, asking about, okay, what do you want an health counselor to have in terms of qualities? We talked about nonverbal a little bit, and of course, relationship building is very important. But what other qualities are we looking for in a counselor? Are we feel safe to open up to? Yeah.
That they qualify.
That they qualify, the credentials, the credentials.
It's going to be more personal for me, but I would want a counselor who is like solution focused. Not citing between personal, but I would want that positive element that reassures that this will not be a problem forever, and that we can get through this together, and that we can find a solution to those feelings that I will be experiencing.
Yeah, and
Lesson.
yeah. And again, that comes down to that relationship building that she was talking about, right? Anybody else, what kind of qualities do we want to have in a counselor? How about the one right here? I know, but the pressure's coming out now. What kind of qualities do you want in a counselor?
It's a person like a soft tone.
Oh, time, yeah. That's important. Like the way we emphasize some of the ways, right? Changes the interpretations just completely. So, yeah. Any other take? No?
I agree with a lot of things you're saying. I would want those things too. Something that's kind of like very personal to me. I would want some structure, but I also need a therapist that can like laugh. I need like as part of my like release for coping, and like all of my therapists that like have these little like ridiculous about something. Like, if it's too serious, it doesn't. I don't feel that comfortable. So
Let's talk about the second one, because, you know, although there's less of a stigma on mental health, we still see stigma of mental health today. And so what kind of barriers, whether it is generational, faith, or culture, might kind of shape the view that we have on therapy in general? No barriers? Have any?
I think the stigma, like, feeling really high need to go to therapy, but because of the stigma, you take, like, Asian American, for example, seeking therapy is honoring of their family, and I think that would affect how someone seeks therapy.
And Dave, I think I know a Christian thing I heard a lot of, like, you need to go to the pastor, and pastor, you know, or, you know, there's a lot of that kind of belief, but I heard even pastors say, you need to go to therapy, you know? You know, so having these beliefs in, so I think that's a big one.
I also think the definitions too. Like, especially here in Hawaii, like the suppression movement with the generational trauma and like cultural loss, and a counselor has a very narrow mindset of what depression looks like, and then you might be boxing with a client and not really helping them with the rest of their ability.
I mean, it does go to the point of being cultural understanding, right? To understanding, again, who you're trying to serve, right? So, how about we open this up to Q&A? Does anybody have any questions for myself? Yeah, sure.
I just had a fascinating discussion on AI, and we'd love to get your thoughts about that. If the foundation, you know, the evidence is about that human relationship, what does that mean in the era of AI? What are the risks, what are the potential benefits? Would that be your take on that?
Yeah, that's a hot topic. I'm kind of in the camp of, I love technology, that in its lane as well. So as a therapist, you know, I like to use AI for something like note taking. I think it could replace assisting with a perfect job, but with something like that, to make therapists' lives easier and prevent burnout in that kind of way. But as far as the AI being a therapist, yeah, we hope that never happens. And I think there's a lot of things in the news, and we have some real caution to that for sure. So I'm kind of under the camp that I think part of that relationship is, it's amazing because it is so important, and that you can't really get with a bot. You can do it telehealth. The research is showing that is just as effective as in person, not for young kids, but for people who are in other modes. And even telephones, some people are struggling they don't want to see their face on the screen, and that can also be very, very effective. So that kind of technology is great. But as far as AI, hopefully they won't be, people will not be seeking that or serving as a counselor.
Any other questions for Melissa?
I have a question.
Yeah.
You said you have to do private practice, and so do you primarily do one-on-one, or do you ever do group work or small group, and also do you work with littles all the way through adults? I'm just curious.
I primarily work with individuals. I do see kids and adults, and have done groups. I have a few groups from time to time, so I've done several groups. So I'm always kind of usually thinking of a group to do, but I don't have any
thing you struggle with is being a counselor in your sessions? I struggle with. I guess like certain qualities you've learned like in the practice that you wouldn't maybe thought about before that maybe you have to adjust to.
Do you mean like counter-transparency or like?
It's just like always around. Like I guess, like, for example, like if you speak really fast, and then you wouldn't really know
I feel like it's always interesting. I feel like I'm always learning about myself and other people, and what I really enjoy about private practice in particular is I found people I want to work with. Before I was in practice, you were in the agency, like, sometimes they want to go in there, because they're coordinated and things like that. And definitely in that kind of setting, I noticed a lot of who I worked better with and then who I didn't, who maybe was a bit harder. But in private practice, I used to enjoy because I felt like they just work with you guys pretty well. But I'm always learning, you're always learning about yourself and people. And I will say with AI, this is kind of with the use of AI notator, and what's interesting about that is it will give us some metrics about the session, and one of the things it gives us is how much time we talk compared to time. And in a 60-minute session, my average rate of talking is like 12 minutes collectively. I don't want to start, So it's the majority, is the client. I would imagine between therapists that would be different. So I think I found like I'm very much a listener. And then the other thing to mention, which is interesting, is cadence of speech. It will say how many words per minute you're doing, and it will give you analytics on what that could potentially mean. So that's been really, really fascinating. And then it will also give you, for the client and yourself, if you are talking in past, present, or future. So those are really interesting things that I find interesting how we have.
Well, we'll give you another round of applause. Thank you, Melissa. Great presentation. There are QR codes in the yes, you can fill that out for the feedback. So next week, there's going to be a Pride Week. And so to go with the Pride Week, we're going to have Kumukaki help to give the talk next week. So please come along and we'll see you then. Have a good weekend. That's good. Using like a tour, huh? Oh, I didn't know what I was supposed to do, so I was like, what? I wanted to hear how they